A new study shows more people are sticking with original Medicare only. But why? And is this actually the best choice for you or a decision you might regret later? Today, I am enjoying a glass of cab while talking to you about original Medicare. So first things first, when we reference the study, a lot of this information comes from our friends over at Deft Research. I'll mention it if it's from a different source. But, question I always get a lot is, what is original Medicare? And essentially, original Medicare is your Part A, which is the hospitalization, and Part B, which is the doctor side of things only. So this is the red, white, and blue card you get from the government or from Medicare. And, this isn't a Medicare Advantage plan or Part C. This doesn't have any prescription drug coverage. It's not a Medigap or a Medicare Supplement. And there's essentially no extra benefits. This is your traditional 80% Medicare pays, 20% you pay. And, that's in general what original Medicare is. So what really are the pros of original Medicare? Now, first and foremost, you can see any doctor that accepts Medicare. So unlike with Medicare Advantage plans, there are no networks associated with original Medicare. As long as someone accepts Medicare, they accept your original Medicare. Typically, there's no prior authorizations, which, essentially you and your doctor make the decisions. An insurance company does not. And the structure is fairly stable. Medicare Part A and B, they haven't changed much. There's very few surprises. Part B goes up slightly every year in premium. But aside from that, there is a lot of stability here. So, with those pros, why would someone choose original Medicare? So first things first, Medicare Advantage. There are doctors and hospitals that go in and out of networks. A lot of these will require prior authorizations, which essentially, a prior authorization is the insurance company choosing whether they're going to cover that service for you, working with your doctor on that. One good example, and this is from Health Grades, is Medicare Advantage insurers processed 50 million prior authorization requests in 2023 alone. So that's quite significant. Most were resolved, but 6.4% were denied. There's a lot of frustration or delays for doctors, patients, et cetera, because of that. And then, why would some choose original Medicare over a supplement or a Medigap? Well, frankly, a lot of times the premiums on a supplement or a Medigap plan are cost prohibitive for some people. They're high premiums. They can't afford that. The plans, likewise, can be expensive and may have to undergo underwriting. There are certain times during your journey on Medicare that you'll be eligible for a supplement with no underwriting. There are other times when you'd have to pass medical underwriting. All right, so, we've talked through the pros. Let's go ahead and take a look at the cons. So when it comes to original Medicare, it does not have an out-of-pocket max amount. I think this is very important, and I'm probably going to say this multiple times in the next minute or so. But essentially, on original Medicare, you pay 20% of most services under Part B, and there's no upper limit. There's no ceiling. You don't know what your worst case scenario is. So for that note, if you have a fairly significant health situation, you're in the hospital for a long time, there's no max out of pocket on this. With Medicare Advantage plans, there is a cap. You have a maximum out of pocket, or kind of know what your worst case scenario is going in for the year. But there's no safety net on original Medicare. So from there, the supplement or the Medigap plans, kind of in comparison, you typically pay little to no out-of-pocket expenses on the supplements or the Medigap plans, but you do pay that additional monthly premium. So you are spending that money each month, but less when you actually use the care. So, I think a good way of looking at this is to kind of walk you through an example here. So first and foremost is a total knee replacement. So, and these are national averages, so they range between $45,000 and $75,000 is the cost of a knee replacement. And if you're responsible for 20%, that ranges from $7,000 to around $15,000. Obviously, at that point, you're going to wish you had a maximum out of pocket on that plan. And that's just for the general knee replacement. You never know, other things that could happen throughout the year. Likewise, heart bypass surgery, nationwide, this could go for anywhere from $80,000 to $200,000, and 20% of that would be $16,000 to $40,000. So it's quite significant. On a Medicare Advantage plan, you'd know going into the year what your maximum out-of-pocket expense would be. You'd be able to look at your per-day hospital expense, etc. On a Medigap plan, you pay little to no out-of-pocket expenses. Sometimes there's a small deductible. Sometimes there's very minimal copays for things you do throughout the year. And most of these plans don't have an out-of-pocket limit or a high annual deductible because, like I said, you're paying a higher monthly premium for this. Now, a couple of things that are worth mentioning is, in addition, Original Medicare does not have any extra benefits. A lot of, especially Medicare Advantage plans now include things like dental, vision, or hearing coverage. These will not be included with Original Medicare. You have to buy a separate plan if you want coverage for those. And then likewise, there's no prescription coverage. One thing I have not talked about at all is the Part D prescription drug coverage. With Original Medicare, to be compliant, and if you don't have a Part D drug plan, you have to purchase one, or someday when you do purchase one, you'll pay a penalty for every month that you didn't have one. We have other videos about that. Go ahead and check that out if you're curious. But really, unless you're getting a standalone Part D drug plan to go with Original Medicare, you won't have any drug coverage. So, when it really comes down to it, frankly, you have to do what works for you personally, but I just do not recommend being on just Original Medicare. At the end of the day, I just think there's too many financial risks. Even if you're healthy, there's no ceiling. I like a good ceiling on a lot of these things. So, if you're going to pay for a Part D drug plan anyway, I would almost recommend that you take a look at a Medicare Supplement or Medicare Advantage plan and just kind of roll it all into a different situation versus just Original Medicare. So if you are on Original Medicare and looking to make a change or just have general questions, give us a call.